What if a green space could change lives? Over the past 15 years, Queen's University Belfast has studied how the Connswater Community Greenway reshaped a city and a community.
Connswater Community Greenway is a transformational, inspirational, living landmark. The idea of the project goes way back to the 1980s, where the community in East Belfast had a real ambition and vision to regenerate the Connswater River, which runs right at the heart of the project. Over the years, we lobbied government and council and obviously wanted investment to change East Belfast in terms of green and blue infrastructure. And in the early 2000s, we're very fortunate to have applied to the National Lottery Living Landmark funding bid. And as a result of that, we were successful in £23 million of investment. And what we have now built is a 16-kilometre greenway, which is made up of a cycleway, a footway. It's a really great example of not just regeneration, but community development and community planning.
Queen's University Belfast led one of the UK's most comprehensive natural experiment evaluations of urban green space to date.
We know how important green spaces are for health. We published a paper in the Journal of Epidemiology and Community Health which showed that in our most deprived neighbourhoods across the UK, a 1% increase in green space can lead to between a 37 and 42% reduction in preventable deaths. So over the last 15 years, I've led a research programme that really evaluates the impact of the Connswater Community Greenway, and this is one of the largest and longest natural experiment evaluations in the world. And what we've looked at is what that impact is on health, on social, on economic and environmental outcomes.
So, what hard evidence can we point to that speaks to the Greenway's legacy?
So I am the manager of Bloomfield Community Association. Dixon playing fields didn't really have anybody in it at all. The impact now is a 2,086% increase in usage. You have families out walking, sitting in the park, having picnics, playing sports, cyclists, people going to work.
For active travel, for people who are walking, wheeling or cycling, for some of their shorter everyday journeys, facilities like the Connswater Greenway are absolutely essential to allow people to get from where they live to the places that are important to them.
With so many of the long-term both physical and mental health conditions that we see day to day, it's really important that we can focus on preventative measures.
There are times when I've had mental health issues. For me, it's just wonderful getting out into the fresh air, cycling along Victoria Park as an example, and seeing nature, seeing other cyclists.
Since the launch of the Greenway, patients are telling us that they're walking more and they're cycling more, and we've noticed a reduction in levels of stress that have been reported as well, so it's really having a huge positive impact on our patient population.
The Connswater Community Greenway is unique in Belfast in that it is the only open space that is lit and accessible 24/7. That's really important because it allows people to use it safely at any time of day. Research from Queen's University shows that this has made a significant impact in that more people are using it in the evenings, and notably more women are using it.
We are always in the voluntary and community sector being asked to measure our impact, and we actually didn't really understand that. I think what Queen's has brought to a lot of us and our organisations as well is that actually having the evidence to back up what has changed through research.
Challenges like safety, accessibility and shared space were met with community-led solutions.
A really important aspect of the work has been the research of Queen's University, and that really gives an energy but also a strong platform upon which to build the work with the local community and other stakeholders.
So our research focused on what the health, social, economic and environmental outcomes of the Connswater Community Greenway were, and we used a range of different methods. So we used repeat household surveys with local residents looking at things like physical activity, like mental well-being, like social connectedness and also their perceptions of the environment. We also did interviews and focus groups with local residents and also different partners and stakeholders to understand what the changes were from their perspectives. We also used like geospatial mapping to understand changes in the built environment and also accessibility. And other methods such as using administrative data, so we can look at electronic prescription data and also hospital admissions to see what those changes are in things like depression, anxiety, hypertension, blood pressure, for example.
So the research that Queen's University Belfast has carried out on the Connswater Greenway over a number of years is really important for the likes of myself as a policy maker. We know it's good, but having research on it and quantifying those benefits on a project level really helps to justify future investment in this type of thing for the good of society.
The Greenway is now a model for urban regeneration, health equity and climate resilience.
Well, I think the thing about the Connswater Community Greenway is right from the outset it was designed to be part of climate resilience for East Belfast, and that was due to necessity because, as you know, there's flood issues in East Belfast at the time. So the project has to double up as being a public space for residents and visitors, but also a serious part of flood defences in that part of the city. So going forward, as the challenges of climate change are more pronounced, we need to think about how the Greenway can step up a gear, what else it can do to respond to the emergency that we face, but also to provide for nature and increase its contribution to the local ecosystem.
The Connswater Greenway is a really, really good example for Northern Ireland. It brings people together and it creates all these multiple benefits. So you've got economic benefits, you've got social benefits, and you've got all those environmental benefits.
It's not just an East Belfast impact, it's actually regional and beyond. You know, Connswater Community Greenway is still looked as an exemplar project. It creates a lobby piece for Greenway development. We're able to say, look, this changes lives.
This is more than a greenway.
It's an investment in health,
Health
And health,
Health.
Equity.
Equity.
equity,
Equity.
Equity and resilience.
and resilience.